Hello?
Cameron, babe, what's happening?
Very little.
How do you feel?
Shredded.
Is your mother in the room?
She's in Decatur. Unfortunately, she's not staying.
So I figured that I would talk a little bit about coughs and colds since I have one right now. According to the scientific evidence that we have, honey is actually better than any over-the-counter medication that you could take. So do not waste your time or money going to get those over-the-counter because, again, honey will do just as good. In fact, they have systemic reviews and randomized controlled trials comparing over-the-counter cough suppressants like dextromorphin, diphenhydramine, no treatment, placebo, with honey, and every time honey actually wins out. They were looking at the outcomes they measured was cough frequency, cough severity, nighttime cough, sleep quality, and then what they found was honey consistently improves cough severity and sleep more than placebo, and it's comparable to dextromorphin and these others that we mentioned. Now, why does honey work? Honey is not just soothing. It actually has real physiological properties and effects. So one is it coats the throat. It reduces cough receptor irritation, vagal nerve modulation, fancy word, our fancy kind of sense there for reduces cough reflex sensitivity. There's especially relevant, or there's viral-related mucosal inflammation. There's antimicrobial and anti-inflammatory properties it has, and it improves sleep, which indirectly improves immune function and symptom perception. So key point, no over-the-counter cough medication has been shown to outperform honey for acute viral cough. And if you look at some of the guidelines, so if you look at the major guidelines and authorities on this, pediatric and adult clinical guidelines recommend honey as first line for cough due to colds. Over-the-counter cough syrups are often not recommended, especially in children. FDA and CDC acknowledge limited efficacy of over-the-counter cough products. So if you're wondering how much to take, so what we looked at, the evidence-based dosing is about 12 teaspoons. That's about 510 milliliters, taken 30 minutes before bedtime, and can repeat during the day if needed. As a precaution, which most people know this, especially with infants, but do not give honey to infants under 1 year old due to the botulism risk. And again, this is natural treatment. Don't have to get out of your house usually to get it. Most people have this at home. It's effective. It's as effective or more than over-the-counter cough suppressants. It's safer, cheaper, better tolerated, and improves sleep more reliably.